So I am Gilda Sedgh, and I'm here from the Guttmacher Institute, which is a non-government organization based in New York. And the mission of the Institute is to do policy-relevant research on sexual and reproductive health topics, so to support evidence-based policies in these realms. So I'll present findings on global trends in abortion incidence and in abortion laws. And this first section on abortion incidence is based on work that we did in collaboration with the World Health Organization. And we estimate that about 56 million abortions take place each year. And that represents a small increase from about 50 million abortions per year in the early 1990s. But the numbers of abortions that happen can increase as the size of the population increases and the number of women of childbearing age increases. So it's more useful to examine the abortion rate, that is the number of abortions for every 1,000 women of childbearing age. And the abortion rate has declined slightly over this 25-year period from the early 1990s till 2010 to 14. And so the abortion global rate now is 35. That means that 35 per 1,000 women, or about 3.5% of women, have an abortion each year. And another way of saying that is about 17 to 18% of women have an abortion over a 5-year period. The trends in abortion incidence are very different in the developed world compared to the developing world. In the developed world, on the left, that's where the decline in the abortion rate is concentrated, and it fell from about 46 to 27. In the developing world, in contrast, the abortion rate has not really changed over this 25-year period. And so now, unlike in the early 1990s, the abortion rate is actually higher in the developing world than in the developed world. And here we're looking at trends in abortion incidence across some major parts of the developed world, in North America and in Europe. And because Eastern Europe is so different from the rest of Europe, we split Europe into these two, Eastern and non-Eastern Europe regions. So what might stand out right away is that the decline in abortion incidence is really concentrated in Eastern Europe, where it fell by more than half over this 25-year period. And that is because the abortion rates were quite high in the early 1990s in Eastern Europe, because during the Soviet era that had just preceded this, women did not really have access to modern methods of contraception. So over this 25-year period, as women have gained access to modern methods of contraception and begun to use them, the abortion rate declined dramatically in that part of the world. And the abortion rate has been low consistently across this 25-year period in North America and the other parts of Europe. Another way that we look at abortion trends is to look at the percent of all known pregnancies that end in abortion. And the percent of pregnancies ending in abortion has been declining in the developed world, but increasing in the developing world. And on average, globally, about 1 in 4 pregnancies ends in abortion. Here, we're not looking at trends anymore. We're looking at countries grouped according to the legal status of abortion. And the group on the left is the countries where abortion is prohibited altogether or allowed only to save a woman's life. And the point from the interesting finding from this slide is that the abortion rate is similar and not statistically different in countries with restrictive laws compared to countries with liberal abortion laws. It's also, I'm going to go back to the previous slide, two slides ago, to also point out that this dramatic decline in abortion incidence is in a part of the world where all countries have liberal abortion laws. And these very low abortion rates in North America and in non-Eastern Europe are also largely countries with liberal abortion laws. And these are the lowest abortion rates on record. And here we're looking at the abortion rates among married women compared to unmarried women. And the UN Population Division defines marriage to include living in a cohabiting union, and we have to use their definition. So married women and cohabiting women have a higher abortion rate than unmarried women worldwide and in the developed world. Unmarried women, now we're looking at the percent of all abortions that are obtained by married women compared to unmarried women. So each pair of numbers adds up to 100%. Unmarried women comprise 35% of the world's population of women of reproductive age, but only 27% of abortions that take place. So they account for a smaller share of abortions than their share of the population. We don't have global estimates of the age distribution of women who are having abortions, but we have information from a number of countries, European countries with good data collection systems. And across these countries, somewhere from 9 to 18% of all abortions are obtained by adolescents 15 to 19 years old. In the statistics of women from Ireland who go to England and admit that they are from Ireland when they have an abortion, about 8% of all those abortions are obtained by 15 to 19-year-olds. And both with respect to those women from Ireland and the women across these countries, the majority of adolescents who are having abortions are 18 to 19 years old. That is, they are late in their adolescence. We did not compile the evidence for a slide on the proportion of women having an abortion who already have a child or who don't have a child. But about half of women having an abortion, and in some cases more than half, already have at least one child at home. We've recently compiled the evidence from about 13 countries on the reasons that women give for having their abortions, and that paper is coming out in the next month. I see a typo right now, because this is our newest slide. But there's a wide variation across countries with respect to how often women give each of these reasons, but these reasons rose to the top as the most common across these countries. She may be having an abortion because she already has as many children as she wants or can take care of. She cannot afford to have a child or another child. Her partner doesn't want her to have a child. Having a child would interfere with her schooling, or she's not ready to even start having children yet. So now we're going to switch from looking at abortion trends to looking at the global landscape with respect to abortion laws. Of the 199 countries or territories around the world, 65 do not legally allow abortion under any grounds, or they allow it only to save a woman's life. 28 don't allow it for any reason, and 37 allow it only to save a woman's life. And in those groups of countries, there are some that nevertheless make exceptions for rape or other extenuating circumstances. And in 74 countries, abortion is allowed for social or economic reasons, or in some of these 74 countries, on request. And among those countries that allow abortion on request, there's a gestational limit of 12 to 14 weeks during which abortion is allowed on request. And then for a more limited range of conditions, such as for health indications, abortion is legally allowed for a longer gestational period. Now, if we just look at the developed countries, in 3 of the 46 developed countries, abortion is not allowed for any reason. In 1, it's allowed to save a woman's life. And in 37, it's allowed for social or economic reasons, or in some of those, on demand. And in case you want to know where Ireland falls in this, it's the one country of the 46 developed countries where abortion is allowed to save a woman's life. And if you want to know which of the countries fall in each of these categories in the developed world, they are listed here. Abortion is prohibited altogether in Andorra, Malta, and San Marino. It's allowed to preserve a woman's physical health and, in some cases, her mental health in New Zealand, Northern Ireland, Liechtenstein, Monaco, and Poland. Now, the ways that these laws are interpreted can really vary across these countries. So in New Zealand, the law is interpreted such that abortion is easily available, and as you know, that's not the case in Northern Ireland or in Poland. And abortion is allowed on request in Canada and in the US and in many parts of Australia. So another way to take a look at the global landscape with respect to abortion laws is to look at the percent of women of reproductive age who live under different legal regimes. So worldwide, about 37% of all women live in countries where abortion is allowed on request. And that's represented by the top bar. In the developed world, 81% of women live in countries where abortion is legally allowed on request. In the developing world, it's 30%, and if you were to pull China out of that bar for the developing world, it would be about 13% of women in the developing world living where abortion is legally allowed on request. So also over this 20-year period of this review from 1994 to 2014, a number of countries have changed the grounds under which abortion is legally available. 34 countries have expanded the grounds under which abortion is legal, and 2 have narrowed the grounds. Those 2 countries are Nicaragua and El Salvador, where restrictions were put in place in the 1990s. In the developed world, 6 countries have expanded the grounds for legal abortion, and none have restricted the grounds for legal abortion. So 6 countries, developed countries, all in Europe, have expanded the grounds for legal abortion: Albania, Switzerland, Portugal, Monaco, Spain, and Luxembourg. And in 5 of those 6, abortion is now available on request. In Monaco, it's now available to preserve a woman's physical health. So in addition to the abortion laws, there's many countries have regulations that guide access or that accompany their laws. For example, in some countries, or in the case of the United States, states have mandatory waiting periods, require a woman to get the approval from her partner, or if she's young, from her parents, or in some cases from a panel of doctors before they can have an abortion. And some require that women are counseled in certain ways before they can obtain an abortion. And some European countries have enacted or changed the regulations that accompany their abortion laws. In Denmark, France, and Sweden, regulations have been enacted that enhance access to legal abortion, or regulations in some of these cases have been removed. And 7 countries have restricted access to legal abortion through the imposition of these regulations. 6 of these countries are in Eastern Europe. We have case studies, so we can give an example of France and Germany. In France, measures have been passed to increase access to abortion services. In 2001, the gestational limit for abortion on request was expanded from 12 to 14 weeks. Minors no longer have to get the consent of their parents. As of 2012, the health coverage scheme in France now reimburses women for 100% of the cost of their abortion. And there was some language in the law that women had to be in a situation of great distress, and that language has been removed. In Russia, a number of regulations have been passed that restrict access to abortion. For women who are seeking an abortion after 12 weeks of gestation, that is now legal for a shorter list of reasons. Pre-abortion counseling is now recommended to discourage women from having abortions. There are now mandatory waiting periods. The amount of the waiting period varies according to the gestational age of the pregnancy. And providers are now banned from advertising their abortion services. So this is the last slide, which gives you one more time a global view of abortion laws around the world. The countries in red have the most restrictive abortion laws, followed by the countries in orange. And the countries in green are those where abortion is legally available on request. And if you are looking for Ireland, it's right there. So thank you very much. We're grateful to our donors who supported this work.